Hey guys, it's the Adrenal Ninja, Dr. Joel Rosen, and I am doing an impromptu Facebook Live. Today we're going to be talking about genetic susceptibilities and we're going to expand upon that. I had a cancellation, or rather a no-show, in one of the appointments that I do to troubleshoot where you're suffering. And it's interesting because we come in on Sundays to do this because I'm really passionate about what I do and I don't have a lot of time during the week to do this. And I'm not bothered by someone not showing up because it's their loss, unfortunately, because I think I could have really helped them. But the thing is that the point is to try to utilize as much of your time as possible, because we don't have an endless amount of time. So what I'm going to do is how else could I help my patient base by answering some of their questions. So there was a great question the other day in regards to, and I'm trying to find it right now, it's in my group, in regards to genetic susceptibilities. And so that's what we do a lot of, and we try to look and see, is there a relationship between having adrenal fatigue and exhaustion and being burnt out with genetics? That's one way that I look at it. So there was a question in here. I'm trying to search for it because I had it a little bit earlier and I wanted to try to answer the question. It was a really great question. And it was posed by a new member. It was Andrea who posed it. And here's what she said. She said, "This is really great information and I really needed the reminder. How do we go about genetic susceptibility testing?" And so the first thing we do is we go through the ancestry test. And hey, Susan, I hope you're doing well. I can see you're watching. And I was really excited to read how well you're doing. So I'm happy to hear all that. The genetic susceptibility test is through 23andMe, or it's through Ancestry, or there's a couple other ones, Strategene. There's a bunch of them that are out there nowadays. They're all popping up all over the place. And really what it does is it gives you the raw data of your gene card. And those gene cards tell us about how well do your enzymes get regenerated. That's really what it does. How well is your DNA effective at regenerating your enzymes? And the enzymes that are required are enzymes that are responsible for really important things in the body. So as it relates to stress, so making your adrenaline and making your dopamine and your neurotransmitters has a real genetic susceptibility to it, where if you're not methylating and you're not utilizing your B vitamins and minerals and cofactors to make different important energy nutrients, then you may not deal with stress very well. You may get anxious. You may not be able to focus. You may have panic. You may feel depressed. You may feel too agitated and irritable. So it has a lot to do with that. And it also has a lot to do with being able to balance your hormones and clear out your hormones and repair your cells and make new cells and new tissues. So that's what's really important about understanding the connection between genetic susceptibilities and stress. But again, Ancestry.com, 23andMe, other reporting sites will give you the genetic data, and it's nothing specific. I always feel like if I could do a commercial, and right after the 23andMe does a commercial and says, find out about your family history, then what I would do is I would do a commercial right after and say, now that you know about your family history, let's find out why potentially depression, anxiety, mood disorders, fatigue, fibromyalgia, thyroid problems, rheumatoid, IBS and Crohn's, ADD, autism, why that tends to run in your family, and how we can specifically customize a recovery program that takes that into consideration. So that's one of the things. So Andrea, you also wrote that I do know that I tested for heterozygous MTHFR, so I've been supplementing with 5-methyl tetrahydrofolate, not folic acid, and methylcobalamin for many years. So that's what a lot of people will do, and it's amazing because as a practitioner, we do that. We make those recommendations. And for some people, it's a slam dunk. They do really, really great. They haven't been getting the active forms of each for their whole life or a long time. And they don't have a lot of other SNPs going on, or susceptibilities, or inflammatory things, or other stressors, and it works like a charm. And then in other instances it doesn't, because it's not complete. It's not addressing what's missing in the way of cofactors, what's missing in the way of gut health, what's missing in the way of inflammatory reactions that are going on in the body, and just your normal stressors. So that's really, really important. Hey Irene, I hope you're doing well. I enjoyed our talk the other day, and I think that Taylor told me he sent you over all the information, so hopefully we can get you more active, and I'm really glad that you're on here. So as well, it says here, I'm fortunate that I really like leafy greens, so I eat tons of them too. Over the last 7 years, each time I've had my blood levels checked for folate and B12, they're always sky high and was above reference range, and my physicians have told me to stop supplementing with them. So that is one of the things that could absolutely happen, is you're taking too much of the supplements. But here's the problem when you do a blood test for folate and for cobalamin, is it doesn't discern if it's reduced or if it's oxidized. Or another way of saying it is if it's ready to go or if it's already spent. And if you don't know if it's ready to go or already spent and you're really high, there's a chance that you can actually be paradoxically low. So what does that mean? It means that you've been supplementing with these nutrients, and they get spent right away. They don't clear out, and now a high percentage of your high levels is oxidized cobalamin or oxidized folates. And that's one of the problems you're dealing with, overwhelm and not being able to focus. If these are the things, and not handling stressors, having chronic pain, crashing in the middle of the day, not being able to lose weight, whatever it is. And so you need to have the proper test and not just assume because you're supplementing with the right nutrients that they're being utilized. That's really important. Then we also have here that I've been doing my research on this, and I found it's impossible to supplement too much because any excess would just be excreted into the urine. That's why I'm responding to this particular feed, because I thought there was a lot of clinical tools in here to explain to you that that's not accurate. That you're right, it can, B vitamins don't get stored. That's true, they get urinated out. But if you are oxidizing your levels in the blood, and those are taking the place of binding sites where non-oxidized, reduced, ready to go should be getting in there, then you're not necessarily concerned for B vitamin toxicity. You're more concerned for B vitamin de-utilization. You're not being able to utilize any of that to make your proper nutrients to deal with stressors. So that's a very important clarification. At first I became a little concerned because I read that high levels of B12 can indicate some ominous fatal diseases. And I would say high levels of B12 will indicate an oxidized form and free radicals being developed. And more than anything, as soon as I see high B12 levels, I know that you more than likely have very reduced glutathione available, meaning it depletes your glutathione, which is your body's main antioxidant, and now your immune system could be running amok, and that's a problem. So usually B12 is a good sign when it's really high like that there's a inflammatory condition, there's a depletion problem, and a de-utilization, if you will. So I hope that makes a lot of sense. And then I figured out that in my case, since I never get sicker over the years, further research taught me that high blood levels are due to methylation defects, which we're talking about, and that's correct, and that I should actually continue to supplement more rather than less, as several different doctors told me to do. And I would disagree with that again, because you don't yell at a deaf person expecting to, you don't yell at a deaf person expecting for them to finally hear you because you're yelling louder. It just doesn't work. And so that means working your way upstream and finding out what are the deficiencies in cofactors, what's going on with the gut health, what's going on with your stressors, how is your blood sugar levels doing, what infections do you have, is your liver overworking, do you have vitamin deficiencies. It's not just forcing it into, in a grinder and just grind it out. It just doesn't work that way. And Rachel, I hope that makes a lot of sense for you, and thank you for joining us. If you guys have questions, let me know. I'm going to go for about another 5-10 minutes and then get prepared for my last call. And then it also talks about further research. We already talked about that. Am I correct to assume that levels appear to be high in my blood because the folate and B12 levels are not adequately being taken up in my cells? Yes. Hopefully we answered that. There's a good chance for that. Or is it that the excess is not clearing from my system properly? I don't know if I would explain it like that, because B vitamins do clear. It's more the first area where it's not being utilized and it's being oxidized, and that's you're not fixing the problem. You're basically force feeding a deaf person, and you're not actually communicating to that person. You have to go around and go upstream to fix the problem. So hopefully that makes sense. A missing catalyst. Can you explain what you mean a little bit more by that, Rachel? Because I'm not sure exactly what you mean. So yeah, hopefully that was helpful for you guys. I just felt that there was a lot of nuggets in there, Andrea. You asked some really great questions in terms of how does B12 get utilized. MTHFR is so much more than methylfolate and methylcobalamin. And yes, a lot of the times the blood tests will be falsely, and they may be misleading to you. Again, I still don't understand what you mean, Rachel. Enzyme. You have here missing catalyst. So these are enzymes that are coded for by your DNA that have to be regenerated and replicated. And if your enzymes are not being replicated efficiently, then you're going to fall behind on producing energy. So it does have to do with enzymes. It has to do with absorbing proteins in order to make the enzymes in the first place, but it also has to do with your genes working appropriately and being able to keep up with demand and supply so that they can regenerate the DNA sequence that makes the enzyme. Hopefully that makes sense. So yeah, hopefully that's all I got for you guys today. I just wanted to have a quick little Facebook Live. And then we got, hey, Brittany, does the Dutch test tell you if you have MTHFR? No, it does not tell you if you have MTHFR. It's a great question. And I do look forward to our call. Had I known this appointment was going to not show up here at 1 o'clock or at 1 o'clock, I would have just put you right in there. So I apologize about that, but I didn't have... I have a 2 o'clock appointment too. But so let's answer your question. Does the Dutch test tell you if I have MTHFR? No, it doesn't tell you if you have MTHFR. It does, however, tell you that if you didn't have an MTHFR test, and I look at phase 1 of liver of estrogen clearance, and then I look at phase 2 of estrogen clearance, and we look at the ratio between each other, and if your ratio is low, that is, your phase 2 is slow and your phase 1 is fast, then what's going to happen is we can assume that you have an MTHFR problem, because MTHFR and everything involved with it is responsible from clearing estrogen from phase 1 to phase 2. So you can infer it. It also looks at your organic acid levels. It looks at B12. And it also looks at B6. It looks at your glutathione. And so those give us some more indication. But what we do, Brittany, is we actually do an ancestry test to specifically see if you do have these enzymes. And then we sort of lay it out on the table, and then like a blueprint. And then we lay out your Dutch on the table. And then we look at the two together and say, okay, here's what you have and here's how it's expressing. So hopefully that makes sense. Hey, Freda, haven't seen you in so long. Sorry, Freda, haven't seen you in so long. Hope you're doing well, and everything's going well. You're local, and here, Linda, too. I see Linda. Hi, Linda. Hope you're doing well. I see your son all the time at the gym. And I guess that makes sense to you, Brittany. What's cool about the Dutch test is whenever I'm working with people from international borders, which we do a lot of, then the Dutch test can be shipped, which is great because it's a dried urine sample. Actually, I have a patient who just emailed me and saying she's not sure on how to do it. There's no cups included, and I need to tell her that what you do is it's a dried test. So you got your own cup, you pee in the cup, you drop the almost like a dipstick into the cup, and then you have it there. So it's really easy. It travels very nicely. And what we've been doing is we've been doing the Dutch Complete Plus now, which is a saliva sample also, which measures your cortisol awakening response. But I'll tell you, here's a trick question. What's the best test, to take? And if you were to pick whatever test you should take, what's the best one to do? And I would say the follow-up test is the best one to do, right? And a lot of people don't do the follow-up test. And it's very important to do a follow-up test because if we're, let's say we're using Brittany as a study of one, and we do a health history, and we look at her CBC, we look at her genetics, we look at her stressors, we look at her diet, we look at her blood sugar, we look at her immune system, and we come up with a plan and we prioritize what we're going to do here, and then we mobilize the plan and we see you get a lot better subjectively. We want to test the test to see what changed and what didn't change, because we use that test information to put a game plan together so that we can retest and see if it's changed. And hey, it's good if you're feeling better, great, you're feeling better, but what if the test didn't show you were improving, or vice versa? What if the test showed you were improving, but you weren't feeling better? So you really need to look at both of those things as well. And Amber, I hope you're doing well. I see that you're watching here. I see you at the gym all the time. So I got all my local peeps here today. But if you guys can ask a question, that would be really helpful. We're just sort of summarizing why it's important to do genetic tests, and because you can really see how it relates to your stressors. And a lot of people, I'll get on the call and we'll talk and we'll troubleshoot what you're dealing with, and I'll find out that you said you've done everything. I've tried everything and nothing works. And then I'll say, well, let's talk about what did they tell you about the genetics? And they said they never did it. And like, well, then you haven't tried everything. How about your blood sugar levels? No, it's perfect. Every time I go to the doctor and I take my blood test, it's perfect. And I was like, well, do you take your glucose and ketone levels throughout the day? And they look at me like I'm speaking Mandarin. You haven't done everything. Or what about, have you done the Dutch test? No, I've only done saliva tests. Okay. So now all of a sudden we start picking apart your thesis of you've done everything and you're not getting better. And I think that's really important, because if you have that mindset that you've tried everything, then you're not open for anything that else you could try. I mean, that's a big deal. And you couldn't have possibly tried everything. Right? So you need to understand that whatever you think you've tried, there's so many more things that you could be trying that you haven't tried everything. So that's a mindset thing too. And then putting them together in the right order, in the right sequence. And then being willing to change that sequence, because the sequence may not be right for you right now. Meaning it may be right for you when you started, but the problem I see is things never commensurate. Like it's like, okay, you're getting better now. You can pull that away and you can try to do something different, and you can try to, a lot of people, a lot of things that I teach is a supplement can be doing what it's supposed to do, but it's not meant to be gavelled against the table and say, okay, Michael, you've been hereby life sentence for taking methylfolate for the rest of your life every single day, don't miss a day. It doesn't work like that. You have to titrate up to a point where you feel good, and then you back off. And you let that sort of jumpstart your system so that your body, it's like a chain, like almost like a ripcord for an engine. You don't need to keep ripcording the engine or the cord to once it's already started. It's going to just mess up the mechanics, and no one's teaching you that. So, hey, Michael, I hope you're doing well. I PM'd you a couple times, but I don't see that you've ever PM'd me back, making me feel like you're ignoring me here. Okay, Tammy, let's read what you got. I recently found out that I have thickening of the heart wall, left ventricle chamber wall. My brother passed away of cardiomyopathy at age 17. Oh my gosh, I'm so sorry to hear that. I know diet and exercise can help, but any advice on this? Yes, lots of advice on this. Diet and exercise can absolutely help, and it's not just a blanket statement to say, next, what else could I do? I mean, diet specifically in terms of stabilizing your glucose and keeping your blood sugar stable, getting foods that are easily digestible and not depleting your body of nutrients that require you to digest them, not getting synthetic or chemically based foods or bacteria-laden foods or rancid foods or moldy foods. Those are really key. Micronutrient dense foods. And then of course it comes down to your stressors, your mental stressors. How are you controlling those? And then I'd want to know about the genetic susceptibility. So I said, at the beginning of this video to do a ancestry test and see how well you're methylating or what your susceptibilities are, so that you can work that into your recovery protocol. I'd also ask you, like, what else are you dealing with? Like, it's not just thickening of the heart. It's probably, maybe it's swelling, fatigue, shortness of breath, dizzy when you stand up. It could also be not handling your stressors very well, not sleeping, overwhelmed. And if those are things that you're dealing with too, then you got to look at it like, okay, let's get you healthy. Let's do all the foundational, fundamental stuff, and then we'll worry about the thickening of that heart wall. Because unfortunately, medicine, as great as it's been, it's tainted us to feel like there's separate entities in the body that don't communicate with each other. And this specialist might get on the phone to talk to that specialist and might talk to that specialist in the real world. But in the biochemistry world, those individual sections of the body are communicating with each other and influencing each other, and it's a two-way road. And it's really interesting. It's interesting. My dad, I wish I could have helped him more, and he's dealing with a really bad, he's dealing with a congestive heart failure, and he was telling me about, his, he's really happy. He's got a cardiologist, and now he's got a doc who's going to help him with his liver, and it's really nice because they really, go out of their way to talk to them and make them feel, make them feel that they're paying attention to them, and that, and I'm like, how is that like a unique feature? I mean, that should be common. That should be just a prerequisite, a good bedside manner, because you care. It's not a talking point of, oh, and I'm really grateful that I finally found a doctor that cares and listens. But that's also what you were dealing with, huh, Tammy, in terms of you also had all those other things too. So yeah, I mean, I would look at getting you healthy. I mean, really, that's what it is. Looking at blood work, seeing what's coming up on there. Are there anemia tendencies? Are there micronutrient deficiencies? Are your electrolytes balanced? What's your liver enzymes looking like? Are there other signs of inflammation? Are your white blood cells and red blood cells normalized? What's your glucose like? Your A1C like? Your insulin like? Your homocysteine like? Your iron? What are all those things doing before we start talking genetics? And then looking at your genetics, looking at your life load, and really custom building a program around that. It really is around custom building your program around that. And, I hope that one of the patients that had my second consult with in a year, I hope she's listening to this, because I really wish I could help her. But, we had our second consult, and I said to her, how come, it was around November of this time last year, 2017, we had another consult and we never got started then. And here we are a year later. Why is it always in November? And she told me, well, it's the time of the year, the season, with her work and her community service. It kind of builds up and hits a crescendo, and then she crashes. And I really want to work with her, and we're not working with each other again. And I would ask you, is this how you wanted the end of 2018 to end? And where were you a year ago? And if you're still suffering with your problem, when are you going to step up and get it fixed? And I mean step up, I mean do all the things that you need to do. A lot of the times you realize there's certain things that you shouldn't be doing that's adding to you're not getting better, or there's also bad thought processes that's acting to it, or there's you don't believe that you're capable of getting better, or you don't believe you deserve to get better, or you just don't see that outcome. And I ask a lot of people, what would it look like if you could have be better? And a lot of people say they don't know what it would look like. And I would tell you, like, DM me if this makes a lot of sense to you, and just say, hey, I want to get better, I'm ready to take that next step. And you and I will just sort of talk back and forth and see if we can help you. And there's Margaret with the show up. Margaret, big hug to you. I feel like I haven't talked to you forever and a day, and I really want to know what's going on with you. We will definitely set up a time. I'll have David give you an email tomorrow so that we can set up a time and see how you're doing, because we haven't talked forever, and I'm hoping you're doing well. And then, of course, here I'm going to answer one more question. So the last question is Paula. Hi, Paula. Hi, I'm MTHFR compound heterozygous. For people that don't know that means that there's a plus minus, an altered enzyme in its efficiency to reproduce, either passed down from mom or dad, but not mom and dad. And at both locations, C677T and the 129AC. I have homocysteine of 11. I would say that's high. From a functional range, 7 to 9 is high. So potentially your MTRR is not recycling B12. Your methylfolate is not getting methylated to pass to move that around. There's a lot of cofactors that are required. Thyroid is involved. Inflammation and heavy metal toxicities and molds could all be sedating those things. I have been taking methylated folate and B12, and those levels are now good, but homocysteine is still elevated. What to do next? Because you're not addressing potentially the cofactors. B2, FAD, riboflavin is a very important cofactor for those enzymes, and it's made activated by the thyroid. So if you have a slow thyroid, it's not making that riboflavin activated. Also potentially mold, candida, yeast, those will slow down those enzymes. Being put on hormone replacements will slow those down. Also your microbiome and your flora may be impacting those. And then heavy metals. So I wish I could give you the secret recipe and say, just do this, Paula, and you'll fix it. But that's the way my mind would work in terms of how we would address this. Hopefully that helped you out a lot. And then lastly, Tammy, God, you're speaking right into my heart. Thank you so much. Exactly what I needed to hear. Okay, good. I'm glad this was helpful. And see, that's another last lesson. So I had an appointment set up today. Like I said, I come in on Sundays to do a couple of calls and finish off a couple of reports. And the person didn't show up. And that's fine. I'm disappointed for them because I know I could have really helped them with their health, and if they're ready to take that next step, then great. If not, here's 5 things that you should be doing right now to fix that, and you always walk away with benefit on the call. And then normally I would get upset, right? But I just know that I have so much other things to do, and doing this Facebook Live is really, really helpful for you guys because it speaks right to your heart. So, and Paula, you're very welcome as well. Thank you. I'm taking. I think you meant taking a lot of. Oh, you're ticking. You're ticking a lot of those boxes. Like, yeah, I got that. I got that. I got that. I got that. It's interesting. A lot of people say you know exactly how I feel, or you describe me to a T. And I think unfortunately I describe you like a T like that because that was me. It really was me. And I see you guys all the time, and I know what it is that you're dealing with, and I'm good at communicating it to you because I think it takes one to know one. So anyways, that's all I got. I got to get ready for my next appointment. Hopefully you found this Facebook Live very, very helpful, and I look forward to ending your adrenal fatigue nightmare. Thank you so much.